We also have an individual who, as CEO, was named in 2023 as Crane Chicago's notable healthcare leaders. And that would be none other than Marcus Waji, who's with us this morning and as president and CEO of Thresholds. Good morning, Mark, and welcome to Choose Views.
Good morning. Good to have you. Can you hear me?
I can hear you. Can you hear me okay?
I can hear you okay, yes. I'm on earpods, so I hope this is working.
Yeah, Henry will give me the nod or the stank eye if he's not happy with the reception. So I think we're doing okay. Well, Mark, welcome to the show, and I'm proud to meet you, happy to meet you because of the work that you've been doing. But you've also got some pretty specific thoughts and observations about where we are currently with our budget and how things are going to be impacting here in Illinois. But first, take a moment and kind of let folks know a little bit about you and a little bit about Thresholds so that our listeners have a little bit more familiarity with you and your organization.
Great, and good morning, everybody, bright and early on a spring March morning. Thresholds is one of Chicago's oldest and largest community mental health and housing organizations. We've been around since 1959. And we currently serve about 10,000 people with serious mental illness and co-occurring drug disorders and histories of homelessness. And we provide, as we say in our tagline, health, home, and help. Home, health, and hope. Sorry, it's a little bit early in the morning. Home, health, and hope to those with serious and persistent mental illness. Really a game changer. We provide psychiatry and primary care with our partners and nursing care, psychological services, employment, education, you name it, everything to help people on the road to their recovery.
Well, and thanks for that bit of information and introduction. It's 1959. I didn't realize that the organization goes back that far. But what's critically important, I think, for people to understand is mental illness has been with us since the beginning of time. We just didn't disclose it as such, and many times people ran away from it. And there's certain communities that don't want to talk about it when it comes to someone that may be even in their family that may have maybe struggling. And it can lead mental illness. Not just acknowledged or treated, diagnosis probably is the word I'm looking for, can then lead to some addictions because, folks look for ways to get some relief. What's been your experience in the numbers is kind of where I'm going with this, Mark. What you've seen in your career, or more specifically your time at Thresholds, are the numbers going up? Are the numbers going down? Where are we in terms of the number of people that are suffering from various mental illnesses?
So, as you alluded to, mental illness, especially serious mental illness, can affect everyone. It's an equal opportunity offender. There are not differences per se based on race, ethnicity, geography. People of any background can experience psychosis and serious depression, bipolar. But what we have found in Chicago and those we treat, sort of the underlying conditions of poverty and lack of access to housing and racial discrimination and structural racism, in fact, really mean that the outcomes, the lack of access to all of the things that make people healthy, they're not equitable. And so Thresholds for 65 years has really served those that have been the most underserved, without access to general health care, without access to food, without access to adequate housing. And so we're really trying to address health equity as part of what we do. Over the last couple of years, especially during the epidemic, the mental health crisis has expanded, has affected everybody, especially young people, teenagers, people of color. Young people of color, especially, so much more impacted, and suicide rates among young Black men skyrocketed during the epidemic. And right now, what we're living through, this current monsoon, if you will, in a country where everything and our ability to serve people is at risk, is just exacerbating what was already a tragedy of epidemic proportions. You know, everybody's reading about the potential cuts to Medicaid, the potential cuts to housing because of federal budget leaders' desire to cut programs in order to create tax benefits for the very, very wealthy. Is really having an impact right now. And we are trying to do everything that we can do at Threshold with our partners to fight these draconian cuts that will literally kill people that we serve and put the organizations like us and everywhere around the country at risk.
Yeah. You know, every now and again when I'm talking to someone that just, let me put it to you this way, Mark. I felt that in my gut because I know you felt it in your gut. You feel it in your gut because you are on the front lines dealing with this. And the way you articulated that is exactly what it is and how it's going to impact all Americans. And I appreciate you making it clear that mental health, mental illness, mental conditioning, mental betterment impacts all of us. You could be, you know, on the highest end of the wealth scale or on the opposite of that and everything in between. It impacts everybody. And just like a pandemic does, it becomes something that no one can get away from. And so in this space where we have federal officials, and let's be honest, let's be honest. I know that you don't necessarily lean partisan. You try to be as nonpartisan as possible, but you yourself have made this clear that policies like this most certainly are going to impact a certain group of people, certain demographics of folks much more harshly than others. And that's why when I talk to someone like you that's doing work in a local community, but something that's a national issue, I applaud the work that you're doing because you know from day-to-day activities that it's going to impact folks right in front of you, essentially. And talk a little bit about how the federal government's match, if I've got this correct, Mark, state money, how that is going to impact, or that not being there will impact even a state that's as strong and as stout as Illinois.
Yeah, so that's a great question. And so what you're referring to there is how Medicaid is funded in this country. In Illinois, basically 50 cents to every single dollar that we spend in Illinois on Medicaid is matched by federal resources, except for the newly expanded Medicaid population that occurred under the ACA about 10 years ago, where there's a 90% match for every dollar that is spent here, which is huge, which has enabled Illinois to bring in almost 800,000 people who otherwise would not have access to medical insurance. Because that's what Medicaid is. Medicaid is not health care per se, but it is insurance that allows providers like Threshold and hospitals and federally qualified health centers to provide the necessary care that people need to be healthy and vibrant, to continue to work and be huge contributors to our community. The majority of people that Threshold has served over the years have been in what's called traditional Medicaid, and they have qualified for that because of disability, because of the mental health disabilities, and, of course, related to their very low income status. But right now, because of a budget that was passed a couple of weeks ago in the U.S. House, sort of all of that is at risk. While that budget didn't mention Medicaid per se, you know, talking about $1 trillion cut, the only way to really get that cut is through deep cuts to health care programs like Medicaid. You know, I said a couple of weeks ago, and I've always felt this. I used to run the AIDS Foundation of Chicago years ago, and I've always said that federal budgets are moral documents. And what came out of Washington, D.C. last week, and what could come out this week, in fact, because the House passed the budget, I think last night, it's going to the Senate for reconciliation, is nothing short of immoral. the most vulnerable people in our community in Chicago and throughout the country, in fact, are at risk. This is not a red state, blue state, urban, rural divide. In fact, while much of the country feels like, and in some ways is really divided, when it comes to Medicaid, every single state and territory benefits, and the people in those states benefit from it. Very poor people and the working poor in downstate Illinois, in the so-called red districts of Illinois, in Iowa, in Ohio, in Texas, you name it. The most vulnerable people in all of these states, including so-called red states, will be hurt. And the institutions that serve them, like hospitals and nursing homes and community mental health centers like Thresholds and all of these places, could simply go out of business. So it's not clear to me sort of how the leaders in Washington are thinking about this at all in destroying institutions that are key to the economic success of our country, and more importantly, to the livelihood of the very people in this great land of ours. But that's the situation that we're in. And Thresholds, as you mentioned, we are not partisan because mental health, and as a nonprofit, we cannot be, but mental health is not a partisan issue. It's not a red or blue issue.
No.
Mental health and mental wellness affects all of us. And so we all have to band together throughout this country to literally fight with love and kindness and compassion, because I strongly believe in that too. I'm a big.
You can be a fighter, but you can love. What did Jane Fonda say once? I hate war, but I love a fighter.
Well, okay, there you go. I love Jane Fonda too. But I love Martin Luther King even more when he talks about love and power. And power without love is reckless and abusive, and love without power is sentimental and anemic.
Yep.
And we have no time to be sentimental and anemic. And we need to use the power, the collective power that we have, and the love that we have for those that we serve to right this wrong. So, we're living in a very, very scary moment, but we have lived through scary moments before. I haven't lived through anything quite like this. When I worked at, as I mentioned, the AIDS Foundation of Chicago in the 90s, and Newt Gingrich's contract on America really threw us for a loop. We organized and we dug deeper and we fought back, and as we did in ACT UP, we acted up and we fought back and we won major victories. So I think it's really incumbent upon us at this moment to not retreat, to not be silent, because silence does equal death, and to fight back with love and power, because the people that we serve deserve nothing less from us.
Wow. I felt that one in my gut too, Mark, because I know you're passionate about it. And I love it when someone can appropriately quote Dr. King other than just the I Have a Dream speech, because the words beyond the popular words are the ones that are most saleable words of Dr. King. And that's so it's so great to hear. I was going to go in a certain direction, but something you said made me think about a part of this that is just critically important. You were quoted as saying, "I've always said in my career that budgets, public budgets, nonprofit budgets, these are moral documents. What came out of the House last week was immoral." You, along with one of our other guests and colleagues, Demario Cooper, who we had on yesterday, was talking about the same thing. When you look at a budget is an indicator of what people think about those that the budget is planned for. And so when I saw your quote, I thought that's similar to what Demario was saying about budgets and about planning. And this right now is highly immoral. I mean, I cannot believe you probably saw this. I mean, we have on one side Governor Pritzker leaning in hard, going on national television, talking about the importance of having budgets that are going to work for all rather than that are damaging to individuals and to our economy and to our infrastructure. And that's the part that so many people don't seem to get their heads around, that this is going to damage our economies, and it's going to damage our infrastructure because people are not going to have not only resources or access to them, but they aren't going to have anywhere, and they're not going to have any allies or places to turn because, like you just said, many of the places may have to shut down. By contrast, I'm just going to say it, Republican representative, and I'm going to put in there a little bit off his rocker for saying this, Darren LaHood talks about that, this is a blueprint for extending Trump's historic tax cuts. It's right there in plain sight. This is not about helping people. This is about boosting them, their agenda to try to re-engage trickle down from the Reagan years. And I know you see it firsthand, but this is why I appreciate your comment about it's immoral.
Yeah, I mean, from everything that I've read and from everything that I have heard, the principal goal of this budget is to extend tax cuts for those collectively who do not need these tax cuts, and the implications, as you stated, the closures of rural hospitals, the closures of urban hospitals, nursing homes not being able to operate, community mental health centers potentially having to close down. Where do these people go? One, where do the people who are working at these places go, which we all care about? I mean, the devastation that will cause to the economy, to unemployment. But where would thousands of people go? Nowhere. The streets. People will end up in institutions that will have to take them but are unable to take them. Jails and prisons could fill because of people without access to housing or health care committing simple crimes of survival, not crimes of violence, but crimes of stealing for food. We've seen this before. This is literally a blueprint for disaster, and I am hoping that folks in Congress wake up soon to the reality of the devastation that this will be at an economic level and, most importantly, at a human level.
So here's the thing I want to tell you, and I want to come back to something you said earlier. We have to organize and we have to dig deeper. I wrote those words down because that is what we have to do. We do have to organize, and yes, we do have to dig deeper. It kind of stinks that we have to do that right now. And I'll be honest with you, Mark, I'm not one that walks around with rose-tinted glasses on. I was looking forward to a period of time in my life and all of our lives where we'd be able to take a deep breath and go, okay, cool. We can move forward in a way where we're all really working together. And I'm a realist and I'm very pragmatic. But your words of organizing and digging deeper, that's where we are right now. And we have to fight. And we've seen worse situations. We maybe haven't lived through them, guys like you and me, but we know that folks that have in terms of our ancestors. So right now, those are powerful words. And I appreciate you saying that. As we wrap up, Mark, just remind people of how they can follow you, follow the organization, and maybe even lend a helping hand to get involved as part of this connection that we need to have to fight through this craziness.
Yeah, thanks for that opportunity. Yeah, if people have an opportunity, please visit Threshold, at least first virtually, at www.threshold.org. You can learn about all the services and programs that we provide and ways to donate to our efforts and ways to volunteer. And, more importantly, if you and anybody that you love needs help, we are there. We operate 4 what are called community behavioral health clinics. We call them Centers for Wellness in Chicago and in Kankakee and in McHenry, so in the greater Chicago area, where people can get, immediate services. It's a really wonderful addition to the fabric of community health. Whatever you can do through your church group, through your block club, through your neighborhood association, through your block itself, I would just say reach out, be connected. Every little bit matters. Do not retreat. Do not be silent. We're in a moment where denial is not acceptable. So everybody has to do their part to be involved. And this is not a moment that I thought we would be facing right now. When I think about Medicaid cuts, what I really thought we would be talking about this year is how we're going to be expanding Medicaid and programs like this that keep people healthy, that help people keep their jobs and recover and help build a bigger, better future for themselves, for their communities, and for the whole United States of America. So that's my plea to everybody. Just get involved. And, in terms of mental health, if you need help, seek help. Do not be silent about that either. That's the worst thing that you can do. And Thresholds and our partner agencies, we want to be there for you. So please reach out.
Mark, we want to be here for you as well, and the organization and the work that you're doing. So we will periodically have you back on the show to talk about Thresholds and talk about what legislation is going on that we all need to be on top of, and to hear those powerful words that you just left our listeners with from all across the country. So, Mark, thanks for being with us. We appreciate it. Stay strong, brother. I got you. I'm here for you to turn to as well. So know that we are here to support you in your work, and just as my mother said so many times when she was alive, head up, shoulders back. So we'll stay in the fight. We'll stay in the fight with you.
Thank you for that encouragement, and thank you for all you do. Okay, God bless.
All right, man. Be well. Talk to you soon, Mark.
Be well.